Assalamualaikum, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all. Salam Malaysia Madani. Distinguished guests, ladies and gentlemen, my name is Nurul Sharbani and Eliana, and I am your moderator for today. Welcome back to the National Institute of Health CME Session 2026, organized and brought to you by the Sector for Research Information Resources, Office of NIH Manager, NIH. And we are now live from NIH Studio Soti Alam via our YouTube channel, NIH Ministry of Health Malaysia. It is my pleasure to be with you today. Our topic today is one of that is increasingly relevant to all of us because technology has become such as an important part of our daily lives. Before we start our session, there are a few announcements that I would like to make. For those who just joined us, do register yourself in the link provided in the comment or description section, and please type or key in your questions, your feedback, your comments, also via the link provided in the same section, and certificate of attendance will be sent via email within a week after these sessions. Okay, so let's move on to our agenda. We use our smartphones to communicate. We use internet to work and study. We use social media to connect with others. And for many young people, gaming has also become an important part of their social and recreational lives. But today's discussion asks a very important question. When does a normal digital use become problematic? And perhaps an even more important question, could excessive gaming, smartphone, and internet use be connected to what is happening emotionally and psychologically in a young person's life? So I am very eager to hear and discuss about the topic today. It is one of my personal interests, and I love to read about this issue. When we hear the word addiction, we often think about substances. Okay, but behavioral patterns can also become difficult to control. The concern arises when a particular behavior starts to interfere with a person's daily functioning, relationships, studies, work, and well-being. So today's session focuses specifically on the three areas: gaming, smartphone, and internet use. So today's discussion is particularly relevant to healthcare professionals, educators, parents, university administrators, and also anyone working with young adults. So to share the findings of the study with us today, we are very pleased to have with us Dr. Nur Hasnah binti Makmur from the Ministry of Health Malaysia. Let me give you a brief description about this young researcher. She is a research officer from the Sector for Evidence-Based Healthcare, Office of NIH Manager, NIH National Institutes of Health, NIH. She obtained her Bachelor of Biomedicine from Management and Science University, MSU, her Master in Human Genetics from University of Science Malaysia, USM, and her Doctor of Philosophy, PhD in Science from UCSI University. She is currently involved in a review study such as systematic review, meta-analysis, evidence-based health policy, and healthcare research, and also in public health study. Besides published articles in a peer-reviewed journals, she also a reviewer of 4+1 JMIR research protocol and on-song public health. Dr. Nur Hasnah is one of the researchers involved in the study that she is going to walk us through right after this. We are therefore very fortunate to have the researcher herself with us today to help us to understand not only the humans, but more importantly, what these findings mean in real life. So ladies and gentlemen, please join me to welcome Dr. Nur Hasnah. So Dr. Hasnah, the floor is yours.
Okay, thank you, Ms. Moderator, Ms. Yana. Okay, Assalamualaikum, very good morning. Selamat pagi to all the audience in our NIH YouTube channels. Okay, let me introduce myself again. My name is Nur Hasnah binti Makmur. You can call me Hasnah. I am Research Officer from Sector for Evidence-Based Healthcare, Manager Office of National Health Institute under Ministry of Health Malaysia. So for today, on behalf of my team members and also our principal investigator of the study, Dr. Muhammad Fazli bin Muhammad Isa, the secretaries with the subspecialty of the addictions, we would like to share our finding on this topic, the association between depression, anxiety, loneliness with gaming, smartphone, internet addiction among public university students in Malaysia. So as for the background of the study, we know that there is a transition between the children to the teenagers, or we know that as the adolescents. So in these two era, the children and also the adolescents, most of their activities have been supervised by their parents, or maybe if they are moved to the boarding schools, their activity will be supervised by their wardens or teachers. But how about when they are moved to the universities and become the young adults? So there is a transition, a very crucial transition to the young adults. So during this phase of cognitive development and life transition, there are many studies reported that many young adults experience the psychological distress. For example, depression, anxiety, and also loneliness. So how does this group overcome or have the coping mechanism to overcome this problem? So they are relying on some things. For example, games, smartphones, or maybe the internet as their coping mechanism for their emotional states that can lead to these addictive behaviors if uncontrolled. So there are few study from Kama et al. In the 2019 that stated that about 89% of Malaysian respondents were addicted to the internet in 2017, with 60% of them showing increasing level of anxiety, and 1/3 of them suffered from the major depression disorder, or known as the MDD. So actually, what is addiction is defined. So there are many definitions of the addictions. We are in the textbooks and also in the journals. But I can help you to simplify what is the addiction means in the three statements. First, the individual have been addicted or craving about something. Next, they will lose their control as they're very craving for that. And lastly, they will lead to the psychological disorder, for example, the depression, anxiety, and loneliness. And much more worse, it will lead to the suicidal ideation and also the self-harm. So, addiction can be defined into two groups, which are the substance use disorder. So, I think many of you will heard about this. So, for example, there are smoking, alcohol, methamphetamine, amphetamine, hallucinogen. So, it include the ketum, or known as the keratom, cannabis, heroin, and others. So another addiction that have not been talked much more in this country, and also if you have read about the HRP12, this behavior addiction have been listed as our priority for the mental health fields. So behavioral addictions, for example, the gambling, gaming, so these two have been listed in the International Classification Disorder, ICD-11, by WHO as the addiction to be included in the ICD-11s. So another addiction you can see here, the social media, the sex addiction, pornography, and others. So in the Ministry of Health and the addiction subspecialty, there have been a guideline for this behavioral addiction and have been published in 2024, and they are focusing in the 4 addiction, which are gambling, gaming, smartphone, and also compulsive sexual behavior disorder. So, but for this study, we are focusing on the gaming, smartphone, and internet addiction because most of the study is associated with the university students. So that's why we are choosing these behavioral addictions. So, what is internet addiction? According to Shaw et al. In 2008, it characterized by compulsive needs to spend time on the internet to a point where relationship, social life, work, and health are affected. So, according to the Raja et al. In 2020, gaming addiction can be characterized by compulsive or excessive use of both online or offline gaming that have negative impact on the person's physical, psychological, and also the social functions. While for the smartphone addictions is characterized by the inability to manage the use of a mobile phone or smartphone, which includes frequently checking messages, tolerance or extensive phone use, feelings or agitation or anxiety while not use or hold the smartphones, and impair the of social life activities. So why we do this study, as I'm saying before, is because first, the vulnerable cohort, as we know that university students face a unique transitional pressure from the children, adolescent, to the university student, where no one is supervise them and they are independent in the whatever they do, in the finance, managing time and others. And also the high digital reliance, because most of the work is need to be done with the digitalized, the assignment and also the final year project, for examples. Next, because it's a fragmented evidence that shows that local data linked psychological distress to behavioral addiction, which remains highly limited. Next, due to the COVID-19 that hit worlds, so many studies shows that there is a rising prevalence, growing dependence rates per mandatory digital integrated in the campus life. So for all this justification of the study, we would like to implicate it in the clinical to identify the core predictors enables targeted institutional screening and also a preventive mental health programs. So the objective of this study, first, we want to determine the prevalence of the addictions, the gaming, smartphone and internet addiction among Malaysian public university. And later, we want to observe association between these addictions with the depression, anxiety and also loneliness. So for the method of the study, we conducted a cross-sectional study with two-stage stratified cluster sampling. First, we do the faculty selection. So how we do it? So we frame all the faculties in each the public university. So the researcher used the simple random sampling to select the 3 faculties in each university. And overall for this study, there are 16 faculties have been selected. So that's the first stage. For the second stage, we select the year of the study selection itself. So similar for the framework, we list all the years of the study where the faculty have been included, and then we use the simple random sampling to select the year of the study, and each faculty we have 1 year to be recruited in the study. So based on the sample size calculation, approximately we need about 115 students for each faculty. So there were 3 faculties, about 345 students in each university, public university students. And overall, the minimum sample size needed for this study is about 6,900 students for all the 20 universities in Malaysia. So this is the map of the Malaysian public university from the Perlis to the south, Johor to the Sabah and also Sarawak, and most of the university, the public university, were located in the Selangor as well as the Kuala Lumpur. So we go all around Malaysia to collect the data. So next, after we gain or obtain the permission from the university, the students were gathered in the lecture hall or classroom, and later the study was briefed by the secretaries. So most of the secretaries that we bring to the field is from the addiction subspecialty to brief them what is this study is all about. And before the briefing, we also introduce what is NIH is all about, because some of the faculties is not from the medical or health science background. So we introduce what is NIH to them. And then if the secretary is not there, the trained investigator will brief the students about the study. Okay, next, student will scan the QR and answer questionnaire in the Google form. So we also obtain the online consent from them, from the Google form. And it took about 15 minutes maximum for them to finish their study. And the student attendance were recorded and cross-referenced with the student registration list in order to prevent the multiple entry from the students. Okay, so this is the picture where we conducted the study. So most of them in the face-to-face scenario or activities, but I think about 1 or 2 faculty we need to conduct it in the offline, in the online, because one or two students have been affected in the COVID-19 because of due to COVID-19. Because when we start this project in 2022, the university just opened for the student to come and study face-to-face with the lecturer. So there is a case where the university had to do the online because of students have been affected with the virus. Okay, so next, in this study, we have 7 questionnaire first, the socio-demographic, and also 6 validated skills, because we have 3 psychological distress and also 3 addictions. So scores obtained from each validated skills were converted into dichotomous outcome based on established cut-off values from the previous studies. So the first question we use is the Patient Health Questionnaire, or known as the PHQ, to assess depression, prevalence, and also severity. So this questionnaire have first validated in 2021, and the Malay version was validated in 2012. Okay, so it contained 9 items, score on the 4-point Likert scales, and a participant was considered to have a depression disorder if they had at least 4 positive respondents, including a score greater than 1 on item 9, or score of 2 or 3 on item 1 to 8. So next, GAD-7, or generalized anxiety disorder, to screen for measure severity of GAD. So it was developed in 2006 and further validated in the general population in 2008. And for the Malay version, it was validated in 2012. And the score, anxiety disorder, is suggested if the total score is 8 or higher. So for the next question, De Jong-Gilbert Loneliness Scales, or DJGLS6. So it got 6 items. Actually, the original got 11 items. So the Malay version have been validated in 2020 with a total cut-off of more than 2 was used to define the loneliness. So for the addictions, we start with the Internet Gaming Addiction Scales, or known as IGDS9SF, to screen the risk of Internet gaming disorder. So we use the short version that have been developed in 2015, and the Malay version was validated in 2021. A high risk of gaming addiction was identified when at least 5 out of 9 items was answered with the very often. Okay, so the next is smartphone addiction scales, or known as the SASSV. So this questionnaire used to evaluate problematic smartphone, and the Malay version have been validated in 2015. This questionnaire contains 10 items rated on the 6-point scales, with the total cut-off of more than 36 was adopted as indicator of problematic smartphone use. So last one is the Internet Addiction Test, or known as IAT, developed in 1998 to assess the level of the Internet addictions. And the Malay version have been validated in 2015. This questionnaire contains about 20 items rated on a 6-point scales. The total cut-off of the 43 or above indicate the presence of the Internet addictions. So we use the SPSS version 22 for the data analysis. So we do the descriptive analysis as a baseline distribution of students' socio-demographic traits, estimate the prevalence rates of mental health distress, and also the behavior addictions. So we proceed with the regression analysis. Both univariate analysis and multivariate analysis was performed to identify independent risk factor and report as the AOR, or adjusted odds ratio. So as for the result, this study successfully obtained 7,278 students from the 20 universities with a mean age of the 21.43. So the female is the most higher respondent compared to the male, and about 57% of the students shows the excessive use of the smartphone usage, which is more than 7 hours per day. So for the prevalence of the mental health distress, it shows that loneliness have the highest mental health distress, followed by the anxiety and also depression. As for the addictions, this study shows that most of the students is screened have addicted with the smartphones as compared to the internet and also gaming. So for the result, the variable of the female become a senior year 4, use 7 hours or more screen times, and have been screened with the depression. All these variables have had a significant difference with the gaming addictions. While for the smartphone addictions, more variables have been shows the significant difference. So the variables such as a female, Indian, come from the Putra Sabah and Sarawak, the senior year 3 to year 5, 7 hours or more screening times, and have been screened with the depression, anxiety, loneliness. All these variables have the significant difference with the smartphone addictions. While for the internet addictions, the variables such as the age 21 to 35, senior year, year 4 or year 5, with the smartphone 7 hours or more screening time, and habit screen with the depression, anxiety, loneliness, all these variables have shown a significant difference with the internet addictions. So for the result and discussion from the study, it shows that males demonstrate a profound vulnerable to gaming addictions, while females is more vulnerable to smartphone addictions. So from the study conducted between 2004 to 2011, it suggests that females generally use online platform for communications, information sharing, and nowadays I believe due to the shopping activities because of the free postage from the TikToks and also the Shopee. So it might be leads to the smartphone addiction to be appear in the female. Whereas male is more preferred to both the online and also offline gaming, especially because they are very competitive to play with the other who is in the online gaming. So as for the research, it shows that Bumiputera, Sabah and Sarawak students show higher risk toward the smartphone addictions. So it might be due because most of the students who reported in this study is studying in the Peninsula Malaysia, means that they come from the East Malaysia, so they travel to the Peninsula Malaysia, so they have to adapt with the new environment. So therefore, they use the smartphone to manage the homesick, maintain the social connection, and also, as I said before, it adapts to the new environment. However, for the Indians, they show the lower risk relative to Malay students. So it might be due to the ethnic or geographical association to not imply in a direct causal relationship, as they likely reflect unmeasured confounding variables such as socioeconomy, status, institutional resources gaps, and also the social support levels. As for the academic years, this study showed that senior year, year 3 to year 5, consistently show higher susceptibility across the all three outcomes: the depression, anxiety, loneliness, on all, and also the all three addictions. So the research suggests that it's due to the compound academic pressure, as they have to submit their final year projects in the time, and also there are many assignments that cause the academic pressure to be occur in the senior. So for example, another example is due to the intense workload velocity and also the higher career anxiety, because after this, they will move to the working era. So most of the students, they have the anxiety because they don't want to live their students' life. Okay, so it is a huge thing that will happen to them. Okay, next, maybe the senior students may increasingly rely on the digital media as their coping mechanism to escape the burnout due to the academic. So as for the screen time, spending 7 hours or more daily on the smartphone consistently driving up addiction risk across all models. So this excessive engagement shift the device from the total use as the primary coping mechanism and displacing essential real-world activities and triggering a self-reinforcing cycle of dependency. So for the mental health distress, so depression emerged as predictor for gaming addictions and roughly doubles the odds for internet and also the smartphone addictions. So study by Vijayan in 2025 suggests that this universal influence strongly aligns with the self-medication hypothesis, which posits that individual experiencing depressive symptom deploy digital behavior as a maladaptive strategy to escape the real world, low mood, and also social withdrawal. So next, the anxiety and loneliness selective predict internet and smartphone addictions while showing no independent relationship with gaming. So this selective highlight the difference between the social function of the smartphone versus gaming. Anxious and lonely students often experience interpersonal hypersensitivity and a high fear of missing out. So I think maybe most of you have heard about the word FOMO. Okay, so they use social media and messaging to monitor social circles. What is the latest trend? What have they have been missed out because of the FOMO trend, and seek virtual validation without face-to-face pressure. So conversely, competitive gaming performs pressure and social frictions that can worsen anxiety. Lonely individuals can also generate the internet problem much more efficient for rapid social connection than gaming mechanics. So as for the conclusion for this study, the screening for addiction to gaming, smartphone and addiction is essential, as these are associated with the psychological distress, the depression, anxiety, loneliness among the young adults. So from this study, we suggest a multifaceted approach is necessary to address psychological distress among UC students in order to mitigate the risk of the behavior addictions. So this is the list of the reference have been used. So before I end up my sharing session, there are many people that I would like to acknowledge. First, to the to the ethic board, for the reviewing and approving the study protocol. To all the psychiatrists, the addiction psychiatrists that come with us to the universities to sharing their expert insight regarding to the behavioral health. To Dr. Fazli, Dr. Arif, Dr. Sasi, Dr. Zila, Dr. Noni, Dr. Jovan, and also Dr. Amir. Thank you for your time to joining us. And also, this study will not be successful conducted if there is no if there is institution no authorities from all the 20 public university. So we would like to acknowledge the university management, the student affairs division for the permission to access the students, and also for the university administration for facilitated data collection process. And also thank you for all the gift they're giving to us. I still keep the gift inside my cubicle, so you can come to my cubicle. This is logged in on my cupboard near my cubicle. Okay, so we also would like to acknowledge the person who are with us from the beginning, Puan Nur Amelia Syafiqah Bahaman, and also her supervisor, Encik Azmi, for allow her to be with us. So Puan Amelia helped us for assisting the public health talks, collecting and data as well. And also, don't forget to all the students for all the 20 public universities in Malaysia for their participation in the study. And not forget to the all team member that have been helping us in the data collection. Datuk Dr. Noor, Datuk Mona, Iza, Fatin, Putri Nadia, Hidayah, Syazwani, Dr. Muhammad Fazli, Dr. Arif, Dr. Noni, and also Dr. Noliza. And also to the NIH driver, mostly to the Encik Rizal. Thank you for arranging the driver to drove us to the university. And not forget the most importantly, because of them, this study have been successfully conducted. Our founder, National Centre of Excellent Mental Health, NCHEM. So from this study, we have been successfully published 2 papers. One in the BMJ Open, published in the January 2026, that highlight the psychological disorder with the internet addictions. And 6 months after, we successfully published in the BMC Psychology. So this one is a paper about the smartphone addictions. So the next paper, we had already sent it to the publisher, waiting for the reviewer. And the last paper, we plan to submit it next year for the publications. So beside the publication, we also present this finding to the multiple conference inside in local and also international conferences. For example, in the WPC, World Psychiatric Conference in Prague 2025, and also in the Globe Health Public Health in Bangkok. So for this conference, we sent our head of sector of the base, Dr. Noor Asia, to present post oral and also poster for this study. So I think that's all I can share about this study. So thank you for joining us for this CME. So I hope this study, this finding will help you if you think that yourself have been filled with these addictions. So don't afraid to go to the psychiatrist. If you got the psychiatrist with the addiction background, it will be fantastic because they will help you to diagnose your addiction through another diagnostic tool we call as the DSM, Diagnostic Statistical Method of Mental Health. Okay, I think that's it for me. I pass the CME to the moderator.
Okay,
Thank you.
Thank you, Dr. Hasna, for that comprehensive presentation. I think we learned a lot about addictions today. Before we proceed to our Q&A session, I would like to remind for those who just joined us to register yourself in the link provided in the description section. And if you have any questions, any comments, any feedback, do type in or key in your questions in the same link provided in the same section. Okay, you will get your certificate of attendance within a week after this session. Okay, Doctor.
Okay.
We have heard that more than half of the students surveyed reported using a smartphone for even 7 days or more per day. We have also seen important findings related to depression, anxiety, loneliness, as well as different patterns involving gaming, smartphone, and internet use. But I think the most important question for us now is, what do these findings actually means for us in practice? So, Doctor, I would like to take this opportunity to explore some of the findings with you. For a start, could you please tell us what were the biggest challenge for your study team in order to complete the study? Is it coming from the universities, variety of the students, and also do you have any sensitive encounters along the way?
Okay. So if you talk about the challenging, there's a lot of challenging, of course. Okay. So
Name a few.
Yeah, name a few. So I will divide it into a few. So I think because from the start we already have the problem to select the staff who will helping us for the data collections. So because we to mesh all the staff time for the data collection is quite tough. So that's why I would like to thank a few staff from the manager office like Amelia, Puan Sarizan, of course, so for helping us for the data collections. So I think in the university levels, the most challenging is for us to went for the data collection. So because we need to send a letter first and call to the faculty in the university. Some university we need to go through the VC, but most of the university just go through the deans because, as I mentioned before, we have selected the faculties in this study. We have selected 3 faculties, so the VC will ask us to go for the deans itself. So another challenge in university, I will say, is because of student schedules. Okay. And also, in the East Coast, there are musim tengkujuh where the banjir is there. So we got experience that we have to postpone the data collection for a month because the university is banjir, got a banjir over there. So because the university is near to another public universities, so we have to manage all the time again. So I think it's about more than a month for us to go back and see the students. And because the student got their final exam, have their co-curriculum, and suddenly their semester break. So that's why we start our study in October 2022, and we are able to finish our data collection in January 2024. It took about 40 months because of this challenge. Because obstacles, very obstacles, up and downs. Okay, so I think that's the most challenging part for us. So I think maybe I would say the transportation for us to arrange with the NIH driver. Some of the place we need to drove by ourselves. Even the Datuk is drove by herself. So I think this is most the challenging part for this study to be conducted.
Okay, so why did you choose only public university? Why you don't involve the private university in the loop?
Okay, that's a very interesting question because in the beginning, we want to include the private university as well. But when we go through the MQA, Malaysian Quality Assurance, that give the certificates to the private university and also public university to help their programs, it is about 141 public university exists in Malaysia. So it will be quite difficult for us to pick or randomize the university because based on the sample size calculation, we need to have at least 115 students for each the faculty. So most of the private university, they don't have the big amount of the students
per faculty.
per faculty. Yes, per faculty. So therefore, because of this problem, so I think it's very accessible for us to go to the public university. And one more thing, most of the study before this, they are only focusing in one university. For us, we are focusing all university students in
So
Malaysia.
that makes your study different from the others.
Yes, that's make the study different from the others.
Okay. Okay. So one of the funding really caught my attention. That was 57% of the student reported using their smartphones for 7 hours or more each day. Luckily, I'm not the one who do online shopping for 7 hours. So I am not addiction category yet.
Yeah.
Okay. So for someone listening today, how should we interpret this? Does 7 hours automatically mean someone has a smartphone addiction, or do we need to look for the other factors as well?
Okay, so like I mentioned before, addiction can be defined in the 3 statements. For first, the individual have the craving that makes them lose a control of something they are addicted and lead to the psychological disorder, for example, anxiety, depression, and also loneliness. So if you don't have the 3 elements, means that maybe you're good. So maybe you can control your timing. So for shopping, I think shopping, because shopping addiction is also listed as one addiction for the behavioral addictions. So like I say before, you can do the screenings as the based on the questionnaire that we have given to the students. But to confirm your diagnosis, I think you can go to the psychiatrists, and it is very fantastic. I say you can go to the addiction specialist, but currently there are about 10 specialists in the addictions, and they are working in the HKL, Hospital Tengku Ampar Rahimah, Hospital Tengku Permaisuri Nur Ashikin, one in the HSB, Hospital Sultan Abahiyah, it's not HSB Selangor, Sungai Buloh. One is in the MUA, in the HTAA, and also in the Tengku Jaafar.
Oh, okay.
So it's about 10 psychiatrists special in the addictions. So like I said before, they will use another tools to diagnose you. So it called as the diagnostic statistical method, or DSM. DSM 5. They're using the 5th edition right nowadays. So there will be a few follow-up. So before they confirm that you have addictions. So there's certain addiction, maybe behavioral addictions, because behavioral addiction is something that you cannot observe it directly compared to the substance use disorder.
Yes.
Because substance use disorder, you know that the person is very craving to the cannabis, pil kuda, shabu, and everything. But behavioral addictions, most of the case that what the specialist told me, the addictions, the persons or maybe the family of the persons will take the patients to see the specialist.
Okay.
Yeah.
Okay. So let's move on to one of the most important things. Your study found that depression was associated with gaming, smartphone, and internet addiction. So why do you think this relationship exists? Does a person that experiencing depression turns towards digital activities because they are looking for an escape?
Okay. So I think that can be one of the factors, because the addiction because people with addiction or maybe they don't know that they have the addictions, they intend to have something that's cause them to have any coping mechanism, like you say. Maybe they use their smartphones to make them forget the problem. More for the students itself, maybe the academic burnout. You know, I think you we have been in the UC students ourselves maybe last 10 years back.
Yes.
In that era, I think we don't have many digitalizing. We are in the textbooks.
Yes.
Now that's the area. But nowadays, when I talk to my niece, the first one, so I don't know, it's not university level. It's from the school level, all they are using the chat GPT, so they're using the Python, whatever. So they are very exposed to the internet itself. So in order for them to be addicted, I think therefore that's why this study show the high prevalence of the addiction itself. Yeah.
Okay.
We cannot do anything about that because everyone is very
Everyone is not on technology.
yes,
right?
on technologies.
Yeah.
If you're not in the technologies, everyone will say you are very far behind. And also the FOMO, you need to forget.
Yeah.
Everyone is talking about the FOMO. So it makes this digital is become essentials to them, even for the kids.
Well,
itself.
because the kids nowadays are born with technology.
Yeah.
Okay, so your study also found that anxiety was associated with smartphone and internet addiction. So could excessive smartphone use actually be related to anxious behavior? You know, for example, constantly checking the messages, notifications, or even social media. I'm not talking about myself, but yeah, I am observer. So I think most of the people nowadays, you know, very anxious to check their phone regularly, constantly.
Yeah.
So what is your opinion about that?
Okay, so that's why I think some of us will use two numbers for our phones. One is for personal, one is for office
Work.
work. Because yes, you know that there will be anxiety will be occur because you keep checking your message because of the your boss. Okay, sorry, it's not my boss. Okay, okay, because my boss.
Anyone else boss?
Anyone else boss?
Yes.
Okay, so maybe there are urgent things to do. I think mostly for the doctors in the hospitals, so they have to check all their phones. So if mostly if they are in the on call mode, so that will cause the anxiety to be appear, and if they cannot control the anxiety, it will lead them to see the psychiatrist because they cannot control themselves. So I heard a few cases about that. So that is one thing that we want to avoid. So some people will use to off their line during the night time because they don't want them to be anxiety about something because some of the boys they send a message 3 a.m. in the morning. So I think it's not very appropriate for the staff. But I think to say it appropriate or inappropriate is up to you how you define. So for
And
me,
how you manage it.
yeah, how I manage it. For me, I just look at the WhatsApp if I wake up and I will send it tomorrow. So I will have my happy sleep. So no need to feel anxiety about that.
Yeah, but it means that feel free to do it at your convenience.
Yes. Yes.
Okay, so I think this is particularly important. A person may have hundreds of online friends and be constantly communicating, but still feel lonely. So can someone actually be highly online but emotionally lonely?
Yeah.
And how does loneliness relate to the problematic smartphone and internet use?
Okay, so I think maybe you have heard about the introvert and extrovert person. So most of the introvert person, they have difficulty to face or to confront with another persons. So that's why they are. I can say it's about netizen lah. If you heard about that. So they are very good in the online in the online era, but if you meet the person face to face, they are very not very outspoken. I can say not very outspoken. So yes, the loneliness have been associated. I think it's not in our study. There are few studies that have been saying that loneliness is associated with the smartphone addiction because they use the smartphones for them to connect with another persons, but in the reality they are still lonely because they are only connect with the person in the online platforms.
Meaning that the online friends and the true friends, you know, are two different things.
Yes, two different things. So that's why loneliness has happened.
Okay, so we have one question from our viewers from Mr. James Tong Wai Ming. He asked about what are the more common and practical ways to curb smartphone and online addiction?
What is the sorry?
What are the more common and practical ways to curb smartphone and online addiction?
Okay, so like I said before, you can hold yourselves to be addicted to that one. So it's come from your mind, how you controls your
Behavior.
your behavior. So if I will say, if there is a program, so I think maybe you can talk to the someone. Maybe in the university you have the counselor, or maybe you are trust with your friends, you will talk to them. So maybe you can discuss, is it you having addictions for that. So this, I think the psychology in the university needs to play a part. But like I said before, the behavioral addiction is hard to be identified because the person itself need to go and see the psychologicals or the psychiatrist
Maybe they
itself.
say that, oh, it's normal because everybody is on the phone.
Yeah. There's something
So they don't
like
think that, oh, I have addiction. They don't think like that.
Yeah. That's why I'm saying that some of the patient who is went to the psychiatrist in the hospitals, most of them is not turn out by themselves. Maybe the wife, the parents go and ask them to go and bring them to visit the doctor, because like I say, behavior addiction is not like the substance use addiction. You can see this is something that you have to admit yourself that I might be addicted. So how you do that? You can use the screening tools that we shared before, and to confirm it, like we say before, you have to go to the psychiatrist addictions. Yeah.
Okay.
Or you can go to the medical officer first, but they are not expert to confirm that you have that addictions.
But sometimes they are feel very, malu.
Yeah.
And some stigma. Okay, if I go to counselor, everybody will talk back behind me like that. So what is your opinion about that?
Okay, that's why we are currently do the stigma studies.
Oh, you have a stigma study.
We are further to stigma studies to know a stigma for the person, the another person, if they see that person go for the doctor, for the psychiatrist advice. So there is there will be a student by our sector, because there is no prevalence right now, the stigma for that. And for your information, we also conducted a study for the behavioral addictions, because behavioral addictions is new in Malaysia, and currently in all hospital, all the main government hospitals, there is about less than 200 cases have been reported with the behavioral addictions. So I'm saying before, you say we are very shy, very malu to come forward if you know that you might have the addiction, but you cannot confirm it because you don't have the person to diagnose it. Is it you having it or not?
So maybe you can say that we may have many undiagnosed cases.
Yes, I can say that.
Okay, so your findings showed that males demonstrated a greater vulnerability to gaming addiction, while females were more vulnerable to smartphone addiction. So what do you think might explain this difference? And should prevention strategies be different between males and females?
Okay, so the males from our study mostly addicted with the smartphone addiction due to the habit of the gaming. So I think when I see like my brother-in-law, like my brother, when they are not doing anything, they will go to the Mobile Legend and play. I think maybe this is a habit for the men. So how they control itself, I think maybe they just play it. They have to limit the time, maybe 1 hour or 2 hours per day. Maybe they can make themselves busy helping their wives. I think like the wife doing all the housework, whatever, everything. And so for the females, they are very also they are have been observed addicted with the smartphone addiction. So I think maybe they are very missing their families member, their friends. So let me say because of this e-commerce, the shopping online have also caused them to be involved in this smartphone addictions. To overcome, so if I can suggest, maybe you can remove your applications.
Not remove your smartphone.
Not throw away your smartphones, so they cannot be occur. Maybe limit your time. Maybe you limit. You have a bank that have the limit for your shopaholics, because shopaholic has also been have been so in the behavior addictions
For women especially.
Yes, for women actually. Okay, so we have to be careful with that.
Okay, we have a second question from Miss Nurani. She asked about, are gaming addictions, smartphone addictions, and internet addictions significantly associated with depression, anxiety, stress, and loneliness? Or maybe is it just a hobby?
Okay. So from our study, it shows that it have been associated. So sometimes that I'm saying that we don't realize that we have the addicted to that ones until maybe we answer the questions. So this all of this of these tools is a screening addictions. So you go for the screening addictions. So that's how that's why the number is showing that. So if you say about the hobbies, I think if the hobbies we have the limits for that. So I don't think we have 7 hours straight for our limitation. But for the internet and also for the internet and also smartphone, because I think most of the work nowadays in the phones, but you know how to control it. You don't lose yourself to control it. You know how when to stop. If there is only 5 o'clock, you go back. Okay, you go back. You don't see when you're driving, you don't see your handphones and everything. So it means that you know how to control yourself. So it's not the addictions like what have been stated in the few research or journals. So I think yes, it have the relationship. You will say it's a hobbies. You have the way how to control it to become the addicted.
Okay, so this is clearly not an issue that healthcare professionals can solve alone. So what role should parents and universities play? And how can we support the young people without making them feel that adults are simply trying to control their phone use?
Okay, I think that must be occur to the parents who controls their children. I think because children nowadays are very into the videos, YouTube videos itself. So I think for that maybe the parents can have a lot time in their smartphones or in the tablets. So they know the limits for them time for their time. So if that's the parents say that their kids might be have the addicted to certain of the behavior addictions, maybe they can bring their their sons or their daughter to see the physicians, and maybe the physician can help to observe first because before they send it to the psychiatrist for the further evaluations. So for the university levels, I think maybe you can talk to your lecturers, or because maybe you have a stigma if you go to the psychology stuff, your friends might be say bad to you because you have a problems. So that's why you see the psychology.
It would be better if me and my friend also have the same problem. Then we go together.
Yeah, yeah, that will decrease the stigma. So I think most of the students in the university, they have their mentee problems. So maybe they can talk to their mentor first, the lecturer. So maybe lecturer can further investigate and maybe can talk to their friends. I think that is more appropriate and less stigma because the lecturer went to see the psychologists who I think maybe a lecturer in the university itself. So it will help them to identify is it that they have the addiction or not. Yeah.
Okay, you keep on mentioning about the screening tools that we can use to screen the sign, any signs for addictions. What if the person is smart enough to manipulate the screening tool? The fact that he or she tried to deny that, oh, I am addicted to something. So how can a counselor or maybe the psychiatrist detect the maybe the result can turn out, oh, normal je.
Okay, so that's why for this behavior addiction problem, because we cannot see it, so there will be a few follow up for that. So I think there will be something that another next 2 weeks, next a month. So is it the students will be answer like before? So there I think about 2 or 3 follow up before they can say that yes, these individuals have be addicted, although they had tried to manipulate the questionnaire, because the questionnaire have been validated, so have been used widely. So it should be no problem, but need to have the few follow-ups to perform a diagnosis.
Need to do it a few times.
Yes.
Okay.
It's not
Okay.
one time.
Okay, so let's make this practical. If someone listening today recognizes some of these behavior in themselves, their child, their students, or even their parents, what are the 3 simple things that they can start doing immediately?
Okay, first, maybe they can sit down. I think they can sit down, talk to each other. Don't judge, don't immediately judge that you have the addiction. Just talk like you have been talk to your parents, or what the person you want to, you think that they have the addictions. Next, you can ask them to just read out the question. I don't know. I think from the conservation itself, it can tell you, is it the person's might have that one. So next, I think maybe you can see you can see friends, maybe a clinicians to help you. Is it that one? And for next, maybe you can slow talk to the persons itself, and asking that and ask that you might have. You don't just say I know you have the, no, you have say you might have. But I think the might is the ayat lembut sikit lah for you to ask the persons to go and visit the doctor, because behavior addiction is not like another disease like hypertension, like diabetes. You have to immediately take a medications. So some of the behavior addiction we just treat with the psycho educations. So if it become more severe, so the doctor will prescribe
The
medications. But most of the behavior addictions, just the psychoeducations, a push only.
All right. So, are we focusing too much on the amount of the screen time when perhaps we should be focusing more on why someone is spending so much online? What is your thought about that?
I think online versus what this question?
Are we focusing too much on the amount of screen time, or when perhaps we should focusing more on why someone is focusing so much online? Why on the screen time, or why they do it?
So I think for nowadays, because of our work, we spend most of the time with the online. So online is related with the screen time. So I think it will be a boost. Is associated with the both our screen time and also our spend time of the internet itself. So let me say, if we can control it, that not cause harm to us. So you are good, because I think nowadays for us, I think for us as a researcher, most of us is depend on the online for reading journals, for making our thesis or proposal itself. So as long as you can control it, you are good to go, and you don't have the addiction for that.
Okay, we have another question from our viewers. Mrs. Robia, she asked about are we addicted to the internet or addicted to escaping ourselves?
Okay, so actually that relates to each other, because most of the study they have published, they're addicted to the any gaming, internet or smartphone is because they want to escape. They want to have the coping mechanism. For them to let go all the burnout they have. For example, the students in the final year students, so they need something to make them forget some few minutes about their assignment, the huge assignment. Then that might be help, might because them not sleep for the 2 days, 3 days. I don't know. I never do that during my student, because I think we need a sleep time to make us become a human for the next morning. So if because we need something coping mechanism. So I think maybe our time, because at that time there is no internet. If we have internet, we call it a rich people last time. So we go to the mall, window shopping, or maybe we have some sweet drinks to make us forget why.
Or maybe you have some human interaction.
Yeah,
rather than phone interaction.
Yeah, because you will call someone and say what you have been facing, what the burnout you have you have been faced. So I think that's how we do during our time, because the internet is so expensive. So we
Those
will
who
go
are
to the
very,
cyber cafe.
quite rich
Yeah.
can only have that full accessibility to the internet during those times.
Yeah, we go to the cyber cafe, and maybe we sit there until 3 in the morning to finish our homework.
Assignment.
Assignment, yes.
Okay, so doctor, before we close,
Okay.
I would like to ask you one final question.
Okay.
If you could leave our audience with one key message from this research, what would you want everyone to remember?
So I think if I can leave something, so I think you have to be, and do you have to know yourself? Do you have been affected with these three addictions we have been talking about? Are you craving with it? Are you lost control of it? And are you and because you're craving and lost control, you have this psychological disorder. So if you have these symptoms, I think you should go for the help, because
Seek for help.
seek for help. So because if you don't seek for help, it can turn this one into the scenario that we don't want it to be
Become worse.
occur. Yeah, become worse. For example, the self-harm and also the suicidals. So this behavior addiction is something that we can manage. It can be treatable, but you need someone that can lead you to the treatments approach. So I think you can just talk to someone that you believe, maybe your friends, maybe your teachers, maybe your lecturers, so maybe your parents. So you have to seek for help to decrease your addictions, and also for your psychological disorder to not be occur for you, so you will have a better life and better surrounding for your next
To enjoy your life.
yes, enjoy your life, because the the students in university is just a step before you go to the working situations. So working situation is not similar as the university. I think you have faced it, Yana.
Yes.
So I think just enjoy your life. You have something that you want to do, you have a problem, just talk to someone. Okay? So be correct when you are choosing your friends for your life.
Okay, so thank you, Doctor.
Okay.
Ladies and gentlemen, as we come to the end of today's CME session, I think there are several important messages that we can take away. First, digital technology is not necessarily the problem. Smartphones, gaming, and the internet use are now an important part of the modern life. So concern is when digital behavior begins to affect a person's functioning, relationships, and well-being. Second, we need to look beyond screen time. The important question is not only how many hours are you spending online, but also what are you doing online and why are you doing it? Okay.
Okay.
Okay, and the third one, we need to pay attention to what may be happening underneath the behavior. The study found important associations between depression, anxiety, loneliness, and behavioral addictions. When we see excessive digital use, perhaps we should not immediately judge the behavior. Instead, we should ask, is this person trying to cope with something? Are they feeling lonely? Are they experiencing depression or anxiety? And perhaps the most importantly is, how can we help? Okay, on behalf of the organisers, I would like to express our sincere appreciation to Dr. Nur Hasna Makmur for sharing her research findings and insight with us today. So thank you, Doctor, for helping us understanding this increasingly important issue. And thank you to all our participants for your attention, engagement, and thoughtful questions. I hope today's session has given us not only knowledge, but also a different way of looking at digital behavior among young people. Sometimes the behavior we see on the surface may only be a reflection of something deeper underneath. With that, we conclude today's CME session. Thank you very much, everyone. Have a pleasant day. Assalamualaikum warahmatullahi wabarakatuh. Salam Malaysia Madani.
Thank you.